Bismillah ar-Rahman ar-Rahim. My dear vascular candidate, a lot of you asked me before the exam, what do you advise me to do before the exam if the exam is 2 weeks or 3 weeks ahead? And for that, I have summarized my tips to MRCS candidates part B. Number one, don't pay the fees long ago. Some of you pay the fees 6 months ahead while he has not started studying yet. And by the time the exam comes, he's not prepared, he get panic, and then he try to take his money. And for that, if he is little bit late, he probably will lose 90% of the fees that he is already paid. So what I advise him is be prepared, study well, prepare your OSCE station skills, and then pay the fees. If you don't do that, there is a lot of you which doesn't show up in the exam, although you already paid the £1,000. Number two is don't panic. It's very important to be calm. This exam is stressful, so is the surgical job is also very stressful. So if you cannot handle the stress of being asked by 18 OSCE station with only 2 resting station in between them, then you will not withstand the stress of surgery if you are opening heart, opening aorta, and you are very stressful, tools doesn't work. One of the aim of this exam is to assess how you can handle stress. And that is why in my virtual OSCE station with Professor Shireen Al-Hariri, we want you to be stressed, to come on the platform, on the Google Meet, be asked the question, and then stress to see how you can get your answer, and then your performance will improve. Number two, read the instruction carefully. A lot of you, for example, confuse between taking history and doing examination. And when you go to history station, you want to do examination. So in all the station, you found the instruction found on the desk when you go in. And this is very important. I want you to read the instruction calmly. If the 1 minute pass, you didn't read it all, you just ask permission. Can I complete reading the instruction? And no examiner will say no to you. So this is also very important. Now, quickly survey the cube that you are going in. And I always advise them, look at the table and see what is there, because if there is paper and pen, you're asked to use them, like writing history. If there is torch, you're asked to use a torch. Tuning fork, hammer, stethoscope, watch. If you doesn't have watch, you want to count the pulse. A sphygmomanometer to measure the blood pressure. So look very carefully into the table. Secondly, a lot of you forget about washing their hands. So one of the nice candidates that I remember very well, he put a hand wash in the belt of his trousers. So he always remember the hand wash, and it's always there with him, so he doesn't need to have the hand wash, because sometimes the hand wash in different places in the OSCE station, sometime on the table, sometime nearby, on the right side, on the left side, and sometimes you don't see them. And with the stress of the exam, you forget to wash your hands. Secondly, first impression count. So what I want you to do is to show me that you are professional. You know how to introduce yourself to the patient, you're confident, your body language stand that you are a professional, because you are being assessed in professionalism is your attitude toward the patient. Now, don't let the examiner put you off. And this is important. We are instructed to give you a mask face, not to do any prompting. A lot of the Egyptian candidates want the examiner to say, yes, okay, you're doing fine. No, we're not allowed to do that. So if you are speaking perfectly, you will get a face with no smile. This does not mean that you have done badly, but it just means that we are not giving you prompting. We just want to know your answer, and we'll give you grades for that. So don't let the examiner put you off. I have seen this a lot of time, especially with Egyptian candidate. When he says something good and the examiner doesn't knock his head or doesn't smile, he thinks that he's in wrong track, and then he start to go back, which is wrong. Be genuine. Don't try to imitate anyone else. Be yourself. Try to remember, introduce yourself. Say you are surgical trainee, you came for the exam. Is it all right for you to examine you? Be polite to the patient and be polite to all the surroundings. Sometimes you can see the assessor, but the assessor is here to assess the examiner, not to assess you. So don't be offended when you see a lot of people inside the station, and try always to be as calm as you can in this station. The exam is stressful, but if you are confident, you've done your study, you should fly through. And I have seen British candidates that they are really enjoying themselves in the exam. They sometimes get a little bit of saying something, smile to the patient, is it all right, it's a bit cold today, and so on. It shows that you are confident, you're comfortable, and this might save you in a lot of station. If I feel that you are very confident, you need it in suture station, in hand skills, you need your hand to be steady without any tremors, and this is important. Always keep track of time. You always are asked to do a task within certain time frame. So if you have 6 minutes in an exam, don't take 3 minutes taking inspection and palpation and leaving the rest. So always be focused on what your target to do, and always think of time. That is why in our virtual platform, we'll give you 9 minutes to do the task. If the 9 minutes is gone, finished. You can't do anything else. So you are assessed on performing against time. And it's very important to know how to summarize things in 2 or 3 sentences, condense it, giving positive information, what you want to say to the examiner. So keeping track of time is also very important. Although you don't have a watch, you're not allowed to have a watch, especially digital watch, inside the exam, but you should be trained about the time passes, and you should be trained to do the exam within the exact 6 or 9 minutes. Always be nice to the patient, be kind. Say at the end, is it all right? Do you want me to help you to go to bed? Do you want me to give you your dress? And do you want your shoes? And always be polite to the patient. Some of the patient, because you are professional actor, they discuss how you have performed with the examiner. And sometimes some of the actor have influence on the examiner when they put their grades. So always be nice to them. Always thank them at the end for their time and for their patience. And this is always give a nice impression at the end of your station. So finally, remember my advice: practice, practice, practice. A lot of you know very good information surgical wise, steps of operation, anatomy, but you don't have OSCE skills, because in most European universities they get OSCE training by year 1 medical school. So you can imagine by year 5 they have done maybe 400, 500 OSCE station, and they are professional. Not only that, but I will put the lecture on a platform called MidAll. And MidAll is a free platform to all doctors, and you get certificate for your learning. So every hour you spend watching video, you get a certificate to prove that you have spent 1 hour in training about MRCS. And this will be useful in your CV and will be useful on your career. Lastly, I wish all of you to pass straight away. It really hurts me when someone does not pass MRCS the first time. And a lot of you are extremely good surgeon, but the OSCE training is what is missing. So this is a summary of my advice to you. I wish you join us on the Telegram group and on YouTube station for MRCS, and on Mid-All group for MRCS course training by examiner and artificial intelligence. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon, and I wish you all the best.